Thank you, Ron. No announcements today, but you will have seen that we've hit 4 million New Zealanders now vaccinated, which is a fantastic milestone. And the Minister was just telling me as well, 90% now in every age group except our under-12s. Well, look, there's been a range of modelling, obviously, that we've seen, and ultimately for us as the government, it's meant that we've undertaken scenario planning for as little as 1,000 a day to over 50,000 a day. We do not at this stage know whether or not we would reach such high numbers, but we must be prepared for that based on the international evidence. What I'd also point to, though, is that the best thing we can do is act preventively. So that means get your booster and, of course, familiarise yourself with the red settings, which are in place across the country. On the modelling, there is vast variation at the moment, and what we've asked is some of our modellers to see if they can come together and look at some of the variables that they're factoring in to give us a bit more of a sense of what we may experience. But look, I think we need to remember the WHO only notified Omicron as a variant of concern 8 weeks ago. So we are dealing with imperfect information. What we do know is the booster will reduce the impact on hospitals. What we've seen overseas is that, yes, Omicron is a more mild to moderate illness for most people, and particularly that the booster will make a difference to ensuring we don't have that pressure on our system. So that's why the best approach New Zealand can take is getting those boosters up. To then come to the issue of then for those who may, for whatever reason, then experience a more severe illness, the same plans that we rolled out around hospital preparedness for Delta hold for Omicron. It may be milder, but the case numbers we're preparing for are larger. And so, of course, that's work that we had in train from the beginning of this pandemic and still holds. No. Countries have a range of gaps between their boosters. Some countries are still at 6 months, many at 4. But again, this is a decision for our clinicians, and we make that call based on what they advise us. Looking globally, you can see that every single country who has had Omicron waves has seen severe pressure on their hospital systems. So that is an experience that's being felt globally. So there is no reason to think New Zealand would necessarily be an exception unless we use all of the tools we have. Go and get boosted. It's the most important thing you can do to help our health workforce to prevent them from being overwhelmed. No one is predicting that necessarily Omicron is the last variant we'll be dealing with, but that's why things like whole genome sequencing continue to be important, and the measures that we have at our border. Yes, they will change over time, but continuing to have testing at the border helps us identify if we are seeing changes in COVID, and sequencing helps us with that. Just recently, the Minister and I received a piece of a report, a paper provided by Dr. Jin Russell and other experts who have advised us strongly to continue with the opening of schools and to continue to ensure we do what we can to keep children at school throughout this stage of the pandemic. Now, they acknowledge that there might be some cases where you have localised closures because of shortages or perhaps localised lockdowns, but the really important message from them was, even in the face of Omicron, the balance of evidence continues to point to keeping children connected to their schools for their physical, mental and emotional well-being.